Hi, my name is Rolbit Maranan. This is my report. It's all about social anxiety or social phobia disorder. Personal information. Social anxiety disorder, also known as social phobia, is an anxiety disorder involving discomfort around social interaction and concern about being embarrassed and judged by others. Cause of social anxiety: child maltreatment, peer abuse, unfair rejections, relative rejections, and learned behavior. Factor about social anxiety: deep thinking and contemplations, quiet solitude, and the company of small number of meaningful social contacts, rather than a large quality of shallow, shallow contact. General symptoms of social anxiety. 1. A person feels noticed, observed, or scrutinized, fear that they will display their anxiety and experience social rejection. 2. Fear of displaying anxiety and experience social rejections. 3. Social interaction are either avoids or painfully and reluctantly endure. 4. The fear, anxiety, or other distress around social situations will resist for 6 months or longer. 5. The fear and anxiety will be grossly disproportionate to the actual situations. 6. The fear of anxiety cannot be attributed to the actual situations. 6. The fear of anxiety. 7. If another medical condition is present which may cause the individual to be excessively self-conscious. Diagnosis about social anxiety. Social anxiety disorder is one of the five major anxiety disorders as listed in the DSM-5. Social anxiety is many times confused with panic disorder. People with social anxiety do not experience panic attack. They may experience anxiety attack in which is the principal fear is having a medical problem. Heart attack. Heart attack. People with social anxiety realize that it is anxiety and fear that they are experiencing. Isolation is an effort to shrink the world around them and make them more manageable. Depressions can be the result of social phobia. Differential diagnosis. Agoraphobia and depressive disorder are often fermented and may both contribute to sufferers becoming housebound. If the distinctions between social phobia and agoraphobia is very difficult, pre, 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 Credence should be given to agoraphobia. A depressive diagnosis should not be made unless a full depressive syndrome can be identified clearly. Common treatment for social anxiety disorder. Cognitive behavioral therapy with an emphasized exposure can reduce symptoms of social phobia exposure. Therapy involves gradually placing oneself in anxiety-provoking situations and associating the fearing stimulus with the response of relaxation or indifference. This is also known as systematic desensitization, and this is a very difficult, including social phobia. Approach approach to clinical cause formulations. Albert Bandura argued that in order to feel happy and function effectively, people must develop a positive sense of self-efficacy. Prevalence of social anxiety disorder. Sus- uh, to stimulate how common social anxiety is, Ronald Kessler, PhD, and his colleagues conducted interview of nearly 10,000 adults across the United States. They asked those individuals about their symptoms of social anxiety and other psychiatric conditions they stimulated. Number one, how many people have suffered from social anxiety in the past year? Number two, how many people have suffered social anxiety in their entire lifetime? They found that social phobia as the fourth most common illness mental health condition. About 1 in 8 people, 12 in 1% have suffered from social anxiety disorder at some time in their life. This is the called lifetime prevalence. In a year, about 7 out of every 100, or approximately 15 million people suffer from social anxiety disorder. This is called 12 months prevalence. This is my social anxiety. Um, this is my social anxiety report. Thank you.